Hello, my name is Haley McCoy, and for my bacteria, I chose to do Bordetella pertussis. So, Bordetella pertussis is the bacteria that causes whooping cough, and you mainly see this in infants that are less than 1 year old. This is a highly contagious acute respiratory illness that produces a violent cough. The shape of this bacteria is rod shaped, gram negative, and small. And the virulence factors, these basically evoke the disease or the bacteria. And this is the pertussis toxin and the tracheal cytotoxin. So in this diagram right here, you see the pertussis toxin that comes with the bacteria, and you also see the cyclase toxin. So the pathophysiology of Bordetella pertussis is that is transmitted by droplets, and this bacteria colonizes on the cilia of the respiratory mucosa. So this bacteria attaches to the epithelium, and then this triggers that violent cough reflex that you get with Bordetella pertussis, or whooping cough. And the toxins cause that inflammation to the respiratory tract because of your violent coughing. And this is also where the pertussis toxin comes in because it anchors the bacteria to the epithelia. The diagnosis, there's different periods throughout having whooping cough, and you have your incubation period, which is 1 week where you notice some symptoms, and then you have the catarrhal phase, and this is 2 weeks where you start getting very violent symptoms, and this lasts for about 2 weeks. You're highly contagious. During this phase, you get a culture done. This is also when you'll start prescribing antibiotics, and also in the paroxysmal phase. And this lasts you another 1 to 6 weeks. And this is where your body is trying to battle off this bacteria. And then you have the convalescent phase, and this is about 2 to 3 weeks. And this is when you start to heal. Your cough slowly improves, and your airway heals. And whooping cough is most common in your infants that are under 1 year old because this is when they're still getting those 3 rounds of vaccinations. And this is also it's also contagious for those who are not fully vaccinated. For treatment, you have your antibiotics, and this is when the bacteria is still alive, so you'll give it during that catarrhal phase whenever you're very contagious. And you want to prevent the transmission to others. So you want to isolate antibiotics, monitor the infants closely, and you also want to make sure you have your vaccinations. So this moves on to prevention. The best way to prevent pertussis is to get vaccinated. Most people have their vaccinations done when they're young. So there will be a period when you're 1 to 12 months where you'll have a series of 3 doses done of the vaccine. And then throughout, this chart shows when you get your next round of vaccines. And for pregnant women, you will also get this during the 27th to the 36th week of pregnancy because pregnant women are also more susceptible to whooping cough. And then here are my sources.